this is the first time I've done this, but this is the Health and Human Services Committee. I'm Saralee Evans, and I'm co-chair of the committee with Ken Coughlin and sometimes with Sheldon. And this date is March 25th. We have a full agenda today. There are 3 items, and after we have these 3 wonderful agenda items, which I'll tell you about, we're going to also talk about the future programs that the committee members might want to put on or have done. And we're going to talk about how we're going to structure various things in the committee. But first, I need to ask if everybody's amenable to adopting the agenda for this.
So
All in favor? And all against? I guess we have an agenda adopted. So the first thing on the agenda is we're going to hear with great anticipation. Oh, how was the pizza?
Sorry, we were there early and everything.
I didn't
hold it for me.
Okay.
just
So
started.
the first item on the agenda is that we're going to hear a presentation from people from Ryan Health Center, which is a very important institution on the west side of Manhattan. And we're very glad they're here. As many people on this committee know, Ryan was often a presence at the committee meetings for many years and was always welcome. And somehow that stopped, but now we're starting again. And we have 3 people who are going to represent Ryan tonight and talk to us. Michael Fagan is here. He is the Chief External and Governmental Affairs person from Ryan. Daniel Pitchinson, MBA, is President and CEO. And I don't have your card. But,
Yeah, hi,
but I think you're Dr. Roshana Lynch.
yes, I am. I'm the Chief Medical Officer at Ryan Health, and I apologize for being late.
Welcome.
Thank you.
And who is going to lead off?
Sure. So I'm gonna kick it off, and then I'm gonna talk primarily about who Ryan Health is, just in case people need a little bit of an orientation about what we've done, and then when we talk about the clinical aspects of our services, Dr. Lynch. We're a little bit of a tag team, so we might flip back and forth as it happens. So to Sarah Lee's point, thank you for having us. Ryan has been in the community for 60+ years. We were very, very active and present in many aspects of the community. We recognize that we have not been as present and external facing, and that is one of our main goals as we move into our strategic plan process. So my name is Dan Pitchinson. As I was introduced, I'm the president and CEO. I've been there for a year as president and CEO. Prior to that, I was executive director of the location of Ryan in Hell's Kitchen for about 6 years, and that's at 46 and 10th. And that's Community Board 4. So as part of my and part of our moving forward is that we want to be more present and not just seen as a doctor's office where people come, but we recognize that being a partner in individuals, families, and communities' health is being more than a doctor's office, but being out there, helping people, making sure people know that we're here, but also making sure that people know what prevention they need. And as someone said, somebody said there's a senior geriatric health a senior task force, and we used to participate in providing health services, and we certainly would like to re-engage those services. So starting off, just a little bit about our history. We are named after William F. Ryan. He was a Congress member from the Upper West Side for many, many years in the 1960s and the early 1970s. He was part of the War on Poverty, one of the leaders under LBJ, and that's actually where the health center movement came out of. We initially had a different, very bureaucratic name, and in 1978, we were renamed the William F. Ryan Community Health Center in his honor. More recently, we shifted it to Ryan Health. Just it was a mouthful for people to say. So so we've been around for about 60 years. Next one. All right, so this is our mission. So we have our building on our legacy of respect and services. We want to understand the impacts of social drivers of health. And social drivers means that we understand, as I said, we're not just providers of primary care, prevention, or specialty service. We provide dental services, optical services, but we also have to be aware of what other aspects of people's lives impact their health. It's great that they can come to the doctor, but if they're going into homes where there's a need for mold mitigation, or if they're concerned about eviction, so that it's going to cause anxiety or stress, or if they're living in homes that have rats, which I know you're going to be discussing later, or hearing a presentation about later.
We have an exciting night.
So those are all things that are part of health that potentially that other providers of healthcare don't ask about, but it's something that we are keenly aware of and are trying to take a holistic approach to addressing people's health needs. So we create safe spaces. We are mostly for individuals who are from underserved communities. Most of our patients live under the poverty level, either about 150% below the poverty level. And our vision is we will continue to deliver healthcare services, and as I mentioned, broaden the definition of what healthcare means. And we're also committed to ending disparities and health inequities. We believe that everybody should have the same access and the same outcomes to healthcare, regardless of what zip codes or what their income levels are, or what their education levels are. And that's what is the backbone of Ryan Health and also of health centers. Slide. So yeah, so as part of being a federally qualified health center, we serve everybody who walks through our doors, regardless of their ability to pay. We have a sliding fee scale that slides very, very low, and if patients don't have the money at the time that they're able, we'll still see them, and then we'll just remind them next time to pay if they can. We get a federal grant to support us. It's not sizable, and I'm a little bit nervous about what's going on in the future, but we get a federal grant to be a federally qualified health center. We also get, which is one of a main benefit as well, is we get malpractice insurance covered by the federal government. So as you'll know, many physicians or hospital groups or private doctors talk about the expense of malpractice. So our providers are considered federal employees under some legal stuff that I do not pretend to understand. So so we have that's a big savings for us. Do you want to go?
That's why.
Sorry?
That's why.
Yes, exactly.
Yeah, so just a little bit about federally qualified health centers. They were really steeped in the civil rights movement. They were a part of the war on poverty. They were definitely there for healthcare, but they were also there to provide other services that people needed in the community. So food, housing, people were having issues with getting banks to open bank accounts, to provide loans, and all of these things were kind of under one umbrella, so that people can come and get healthcare, but they could also be seen and be treated in dignified, respectable ways, and be able to have other service provided to them that maybe other healthcare facilities we're not really working on or helping them with. So today, there are about 1,400 federally qualified health centers in the US. They collectively serve 32.5 million patients. So if you think about it, that's about 1 in 9 patients in the US get their care from federally qualified health centers. So we are really a big part of the primary care space and really trying to prevent chronic diseases by people coming in and getting visits while they're still healthy. So we can identify things instead of people going to the emergency room when things have gotten out of hand and cause a really sizable amount of medical debt by doing that. So we are really trying to prevent those things. We serve about 52,000 patients. We have 225,000 visits a year. 88% of our patients are low income. About 70% of those are in Medicaid and or Medicare. 8% of our patients are uninsured. This is higher than the statewide average of 5%. About 75% of our patients are people of color, and Ryan Health is serving about 9,000 of our New Yorkers or asylum-seeking children and families. We have been on the front lines with providing vaccinations when there's a measles. There's a measles outbreak happening in different parts of the city and the country. But over the summer, there were some measles outbreaks happening, and we were called in by the DOE and some of the family shelters, and we took our mobile van and we vaccinated children and families for vaccines. We've been outside of some of the public schools where children were going to be released from school because they didn't have the proper vaccines. So we came so that children can stay in school. So we've been doing a lot of work in the community, and we want to continue to do that and want to make sure that everyone knows that we're available. So we have 7 primary care centers throughout Manhattan. We have 3 school-based health centers, and we have 2 community health outreach centers. We have a mobile van, and we also have an emotional wellness center in Midtown.
What was the place?
Emotional Wellness Center, which is our mental health facility, which we have in Midtown, and we also have one on Amsterdam, 801 Amsterdam Avenue. So in your community board, we have West 97th Street, which is between Columbus and Amsterdam. Then we have 801, which is our Women's and Children's Center, which is on 801 Amsterdam Avenue, about 100th Street. The Emotional Wellness Center is also in that location. We also have WIC in that location. Mm-hmm. And then we have a school-based health center in Young Women's Leadership School. I don't know if you have the address for, I don't know.
Further north. 102nd Street.
Okay, yeah, I didn't remember. We have 3 of them, so I don't remember all the locations. And then we have a mobile health center that you might see anywhere in the city, and that is a primary care designated health center. So we have 2 exam rooms. It's usually staffed by a medical assistant, a nurse practitioner, and a driver. So some of the things that we do, these are just some of the primary care services that we provide. We provide pediatrics, adult medicine, adolescents. We provide women's health services. We have something called Teen Night, where teens are able to come and get care without parents. And so we can have different type of group presentations. We can have different talks about things that teens may not want to talk about in front of their parents, but it provides a safe space for these things to happen. And also with a medical professional there to dispel some of the myths that some of our teens may hear about or see on social media. So we have stuff like that. We have women's health. We do primary care. We do primary care for patients living with HIV, adult medicine, vaccinations, pediatric vaccinations. We do a whole host of primary care services.
There's a question now.
Sure. Yes.
Okay. For the teens, if they become aware that they have an STD, can they get treatment without parent consent?
Absolutely. So we have ways that we can bill so that these visits are not do not go to their parents' insurance. So if a child is covered under their parents' insurance, you get the EOB after, and it tells you all of the diagnosis codes, and it kind of lets you create the picture and know what's happening. There are ways that we are able to provide services in treatment without that happening.
New York State is very progressive in allowing, I think it's people above the age of 12 or 13 to access certain reproductive services or certain other sort of STI related services without having the provider having to inform, as long as the provider assesses that the patient fully understands what's going on.
Yes. So these are some of the other specialty services that we provide. We have dental, we have optometry, nutrition, GI. We have a geriatrician that works with us throughout the city, a urologist, a podiatrist, and then we do some case management stuff for our patients that need a little bit more hand holding to getting to appointments, more like patient navigation, and also radiology services. Within our mental health department, we have a psychiatrist. We do depression screening on all of our patients to identify if patients are having any signs and symptoms of depression. Sometimes, you hear depressed and people just think that's just a sad mood, but it's not. It can manifest itself in all different ways. So we screen for that. We provide therapy. We do group therapy, play therapy, art therapy. We provide medication management, both with our psychiatrists, but also with our primary care providers, because we know that patients trust their primary care providers. So sometimes the discussion around medication is an easier conversation to have with someone that you've been seeing for many years, as opposed to referring to another doctor. So we understand that, and we treat people accordingly. We also have addiction services. We provide medication assisted treatment for patients that are living with opioid use disorder. We also have, for alcohol use disorder, we prescribe medications. There's medications that are FDA approved for that. So we screen our patients to see if anyone needs this type of assistance. And then we provide a judgment-free zone for treatment and discussion about that.
So I'll take this one. So the population health is we address, as I mentioned, the whole needs of the community. And we acknowledge the existing inequities and we try to deploy resources. Obviously, as a community health center, we don't have all the dollars that we need to address. So we partner very closely with most other organizations, other community-based organizations, the city and the state to try to ameliorate some of the conditions that might make what is typically thought of as health conditions to improve them. I think we have another slide that has that. But so we work on, oops.
Just going
Sure,
back to
sure.
that.
Can you go back to the slide?
How do you choose so 2 questions. How do you choose who you partner with? And you have a website. So like when you're referring people to community groups, do you give them the list or you're like, these are the best places to go? How does that actually work?
So we internally know who people get the best outcomes from. So we tend to have people, when we present them with options, because there are always options, is say that we've had good experiences with this organization. And a lot of
how do you prevent those good ones from getting overloaded? That seems to be a problem.
Well,
that's often the problem.
Usually a lot of the organizations, it's bi-directional. So they're looking for places that have access to good healthcare for individuals who are of lower income groups. So sometimes we just exchange phone numbers and just, say.
But I mean, like if they've had good experiences with organization X, so everyone's referring them to that one. The capacity is that hasn't been a problem, or has that been a problem?
I would say like for dental services, there's not a lot of dental providers for individuals.
Yeah, but I mean like this stuff. Like, if you're going to food pantry or transportation or childcare or whatever, I was focusing on the social drivers, not the medical.
Sure. Yeah. So I think we tend to use the people who are the feedback from our patients are that they're treated with respect and that they feel, and I don't think I've ever been told like stop sending us people because we're overloaded. I mean, I think I can remember one pantry during the pandemic say, more than saying don't send people, they just say is we can only serve X number. So I think people will try to limit it that way.
Yeah, and we do try to close the loop on those referrals, so we don't just refer out and say, here's the list, call. Most of it is now within one platform. So a lot of community based organizations are in the same platform. So I refer to you in the platform, and then we can have dialogue about the patient within the same platform to say they called, I set up an appointment, and then we can go back and forth. We have care coordinators that work on that platform that do that. The other thing is when you go to our website, we have a patient-facing platform that's the same as our internal one. So when they're reaching out to these community-based organizations, it says it is a Ryan Health patient, that this is where they came from. They came from the Ryan Health website. So then they are attributed to us. So then we can go back and forth and have that same dialogue about particular patients. So we don't just refer out, we do try to close the loop on that to just make sure that the patient was able to connect, that they were able to get the services that they needed. So we do.
So I'm, full disclosure, I'm an internist at Bellevue. So I do a lot of these issues. Do you like then measure the impact? Like, are you measuring like they go to this?
We are.
Pantry X, they have whatever better incomes, outcomes with this.
We are, yes. So that is the reason for using these platforms. And then there's some other things happening with trying to make sure people are aware of other resources, because like you said, if I only know about this one resource and I keep sending people there, but I don't know there's another one 2 blocks away, just making sure everybody's informed when new organizations are started, and if they've expanded their services, okay, they're now able to help us with housing, employment. So it is really important that we work with partners that are just our mission aligned as us, so that they are able to provide a great service for our patients.
2 questions. One, someone comes to you and they don't have any insurance and they're going to need Medicaid. Is there any ability at Ryan to help them with the applications and so on and so
So
forth?
all of our locations have Medicaid enrollers. So we have people who have access, they can access at the center.
And the second question, relationships with other health facilities.
So we have a very close relationship with Mount Sinai. Mount Sinai hosts their adult internal medicine residency program at some of our locations, West 97th being one of those. So we have our employed physicians. We also have the residency program from Mount Sinai. It depends on location. So our location on the Lower East Side was not too far from Beth Israel, Mount Sinai, which obviously we've all read about recently. So many of our patients were born there. That was the hospital of their choice. Like when they got sick or needed, they would go there. In Hell's Kitchen, many of our patients go to what is now known as Mount Sinai West, the old Roosevelt Hospital. I shouldn't say old Roosevelt Hospital, but what was previously known as Roosevelt Hospital. And for some of our location here, people go to Morningside or St. Luke's. So,
if someone needs to be admitted, they go to the preference is the Sinai location, or does it matter? Does it?
No, we've actually expanded. So I've been meeting with a lot of the CMOs from HHC in order to coordinate care in any way that we can. So we are doing a lot more referring within the HHC system. So I've met with CMOs from Metropolitan, from Bellevue, from Harlem. We're caring for the same patients. I just had a meeting with the chair of GI from Metropolitan to see how can we expand their endoscopy suite so that we can do more direct referrals. They're a great
So we
team.
sent- We send our patients there too.
Yeah. Yeah, so
we.
we discussed that they are like the only
Yeah.
endoscopy suite within HHC that does direct referrals. So how can we like help in any way? So yes, we are expanding our scope of hospital partners, and our patients have been giving such amazing feedback from the care that they and the just the customer service at HHC. It's, I think the mission alignment, it means a lot.
When the COVID vaccine first became available, the only place I could get shots was the Avenue D.
Really, at our
yeah.
Lower East Side.
How wonderful, how caring they were.
Amazing. That's great to hear.
We did,
I've only been before that up to the Upper West Side.
Yes.
I think we
and
did.
But I was very impressed.
75,000 COVID vaccinations. Federally qualified health centers were one of the first avenues for those to be released. So we did tons.
Absolutely. I mean, I remember when there were a lot of restrictions around who could get the vaccine. I don't know if you remember that there was an age, and then there was chronic diseases, but you had all of these people that still wanted the vaccine. So we used to have a line of people lined up outside 97th Street. So if there were any doses left when we were closing, we could give those away because we didn't want to throw it away. So we would go to Whole Foods and just be like, we have like COVID, we're about to close, like who wants a COVID vaccine? And people that weren't in the criteria, we were just vaccinating whoever and whomever came through our doors. So that's really great to hear that you were able to get your vaccine with us.
Me too.
Oh, amazing.
So maybe you should finish
Sure.
the slides.
Sure.
Yeah.
So we're very proud of our highest quality care. So individuals who work in the healthcare field know about Joint Commission. So we're accredited by a Joint Commission. They come in and do a very, very thorough survey, and we've passed it. We've won many U.S. Department of Health and Human Services quality awards. We're a patient-centered medical home. Health First, which is one of the largest providers of Medicaid managed care in the downstate region, has given us award as one of the highest providers of Medicare and for federally qualified health centers. And Mount Sinai Health System has named us as their best community partner. So we take that very proud because we have many community partners. We're also an advocacy group. We are often in Albany and Washington, trying to make sure that the voices for our patients and our families that we serve in communities are heard. Sometimes they're very, very busy going through their day-to-day business and don't have the opportunity. So we see that as part of our job. And since we rely so heavily on federal, state, and city funding, we want to make sure that that's not reduced as much as possible, given that expenses are going up and up. And we want to try to do as much as we can with what we have. So right now, some of our main priorities are just improving reimbursement reform. We were just in Albany. So health centers have not had an increase in their Medicaid rate since 1999. There's been the 1% and 2% annual, not cost of living, but essentially. But costs have gone up 48% in that time period. So and certainly labor costs. There was not electronic health records in 1999 to the extent just everything has gone up. So it makes it very, very difficult for us to continue to deliver these even more comprehensive services that one expects from their health provider when we are not getting increases. Yes.
What can be helpful to this committee and to the board, if there are specific things that you're looking to advocate for most funding from the state or the city, that's one of our roles. Okay, not only in terms of a resolution and spreading that around, but in our district needs and recommendations for expense budget. So use us.
Thank you.
Yeah, I would say,
We're only city budget, so we have a for 2027 fiscal year.
Is this Gale Brewer's
2027.
district?
Yeah.
We will submit a capital budget request and expense budget request.
But if it's something state, we can advocate with our state electeds.
And also Sean Abreu.
Okay.
It's both Gail and Sean.
Okay, great.
So I think one of the
Linda
issues,
Rosenthal, who's part of the health,
yes,
Yeah,
and
she's
she's a
there.
great supporter. I think given the state budget timeline, where I would focus is our need for support around school-based health centers. Because that budget doesn't come due till the end of June. There's a proposal to support community funding that had, a lot of our school-based health centers, including our own, don't get any city funding. And so I can pass that along to you in terms of what we're looking for, and it would be very helpful to have a resolution.
And as
On that, we would put it into our district needs statement for anything that has to do with the city. Our fiscal needs statement for fiscal year 2027, we will complete in October
Okay.
of this year. And then we also can put a capital expenses and
Okay.
capital budget requests and
supporting residents.
and
the more specific to the item better, and if there's a dollar figure, that's excellent because that's what they're looking for.
And we'll get you all those details.
And I just wanted, and I agree with Roberta and Shelley that obviously our purview is New York City, and we do extend to the
New
state,
York
but
City.
we don't always, we sometimes lean into the federal government, and Jerry Nadler, of course, is quite involved. If anyone was at the state of the borough this Sunday, he didn't pull punches talking about the threat. So my question to you is, you alluded to it earlier, what can we do to help defensively to prevent Doge and the new Secretary of HHS, who has different opinions on vaccinations? We have different issues. You mentioned gender affirming care. What can we do defensively to support this?
So
especially on the federal
Maybe
level?
not call attention to this.
So I will say, as a federally qualified health center, I am not permitted by law to advocate for one side or the other, but, if I was sitting in your chair, potentially to write to the elected officials that supporting gender affirming care is critically important for the community, that diversity, equity, and inclusion is something that is a value of the community and that should be a high priority.
We're very lucky because most of our, I would say all of our electeds are on board with that.
So when we go to Albany, and because we're Manhattan based, most of our elected officials are big supporters. At the same time, there is, potentially we could raise taxes on the very wealthy and redistribute some to lower income groups. That is just, that's me. That's not anything that has to do with Ryan, but there's different ways of managing things. So I think just being a constant voice, so that our elected officials know that these are core values, and that even though that they're core values, that they're hearing the core values from their constituents and from individuals who are interested enough to be part of the community boards would be critical. We've met with Michael Lasher, we've met with Linda Rosenthal, we've met with all the elected
Brad.
officials. Senator Brad Horman Siegel, Senator Jackson, everybody, Senator Kavanaugh.
Can I suggest another partnership?
Sure.
Have at least 1,200 senior poor residents in the West Side Federation for Senior and Supportive Housing buildings on the West Side. I'm the president of the organization. I could be a good conduit if you're interested. Most are in the upper part of the district.
Great. We welcome that, and that's what we're here for. So these are some of our partners. Fountain House, which is in Midtown, does clubhouse model for seriously persistently mentally ill individuals. It's been modeled across the world actually right now. Goddard Riverside, which is very close. I'm not sure if it's in this community board.
Yes.
Their clubhouses, we had a resolution to help support their clubhouse because we were afraid that it was going to close because the city was going to have much larger clubhouses than its clubhouse. And Gail was very helpful in keeping the funding.
And so we work with organizations that are near or close to most of our centers. But we would, if you come across partners who need access to health services or behavioral health services or addiction services, we're here for that. That's what we're here for. and especially for individuals who are from lower incomes.
Saralee, you have a question waiting on the Zoom if you don't.
Okay.
want to take that.
Want to take the question?
Maybe we'll, can we get?
This is the last slide.
That's the last slide.
Yeah.
So we're also looking for board members for our organization. Community health centers are by statute and by legislation. More than half of our board have to be patients. So it's very unusual. A lot of boards are for individuals who are raising money, and we're not opposed to individuals to help with fundraising. But we are also, the very mission was that it was supposed to be patient founded and patient driven, and patient would have input, and that meant also governance. So that comes out of the 1960s. So we are looking for people who are interested in making a positive impact, expanding their networks, gaining leadership experience. Obviously, all the people around this table are already doing it because they're part of the community board. But if you know individuals in your own personal networks or in your buildings or in your neighborhoods who are looking for an opportunity, we are very, very interested in talking to people about what it means to be a director of a local community health center. So, take questions. Is there a question on Zoom?
It seems so, but maybe the person doesn't have a question anymore. Erica, if you can hear me, you want to ask your question, you're allowed to speak.
Don't see it.
Eric Overton?
Yeah.
Great.
Oh.
Chief of Staff of Linda Rosenfield.
Yeah, yeah, we,
Oh, and then we have from the results.
we know Erica well. We've met with her many, many
Oh,
times.
and
She's
then,
terrific.
Gilbert is joined us as well.
Did you want to speak?
Hi, Gail.
Hi,
Hi.
Hey, Gail.
how are you? Oops. No, I'd just like to say how much I love Ryan Health Center, and I have, I think I was there from the very beginning. But what is nice to hear is just the other day, I happened to have gone to court and have a guardianship of an undocumented asylum seeker who's under 21, or who's just 21. Long story short, he's got his New York City cares, and now I guess the way it works is if you're in school or working, then you can get Medicaid. So he's applied for Medicaid. I'm learning how the city really operates. Meanwhile, he had some, I don't know, something with his shoulder or heart, I don't know. I said, go to Ryan. So he goes, and of course he got the best possible support. He's a wonderful young man, speaks Fulani, French, and English. He learned English on YouTube at the shelter in Staten Island. And so, he would be a great board member. I'm just saying, I don't know if you can have undocumented asylum seekers for board members, but he's really special. Anyway, long story short, you got great service. He got his blood test back or whatever, and he's fine. But I just want to say thank you again and again and again. It's really phenomenal.
Thank you,
Thank
Councilman
you.
Brewer. You've been a tremendous support for Ryan all through the years, and you've come to many of our events, and we're grateful
Yes.
for everything you do, not just for us, but for everybody in the community who really needs a voice.
Yeah, you're amazing. So I'm a big supporter. If you want undocumented board members, let me know.
Yeah, I think on the side is, there are no prohibitions at this time. So if it's somebody who'd be interested, we'd be willing to talk to him.
Well, he's very special.
So are there any other questions? Everybody's been not shy, and that's good. Anybody have any other set questions at all?
I have one quick question. Your mobile health, is that mainly for homeless people, or is it just around the city? Like, how does that work to target populations, or is it just like set up in a certain place and people come?
So we have done different types of models. Before COVID, we were out in the community 5 days a week, and we had a set location. So people were coming to get their primary care services, just like at a brick and mortar, they would come. Now it's more based on like need, where people want to form a partnership with us. So we we recently were at like a mosque, so a mosque that was doing some outreach for people that were doing asylum seeking, but they were looking for medical services. So we brought the mobile van to provide some medical services, vaccines, stuff like that. So it's more now like demand. When people call us, we come wherever the patients are.
That's great.
Yeah.
Just one other question. If I'm a person in the community, I don't know much about Ryan, someone says go to Ryan, do I just walk over to Ryan and say I'm here? Or do I call, make an appointment? What do I have to do?
So we prefer that people call or go online and make an appointment, but it's not uncommon for people to walk through the doors and say, I don't feel well and someone told me to come here. It's not always easy because obviously we don't have doctors standing around all the time, waiting, hopefully maybe there's a no-show in that example that you give and we can stick somebody in, but there's a registration process where we want to help people get Medicaid if they can qualify for it. But yes, we prefer not walk-ins, but sometimes when people get sick.
We have same days. Yes, absolutely. And we have same day appointments for our patients and new patients who need assistance or need are not feeling well. So we do have same day walk-in availability and access.
So our website is ryanhealth.org.
And we have an online scheduler.
Yeah, on the top of the website is a link to the online scheduler, but also throughout is our patient call center, which is 212-749-1820.
The Medicaid enrollers that you mentioned, are they also social workers, or do you have social workers on staff?
So our social workers are more clinical social workers as opposed to doing like concrete services. So our social workers that we have on staff are licensed clinical social workers doing psychotherapy. Any patients that need more navigation, we're using maybe patient navigators or care managers, but social workers within our organizations are used for more clinical work as opposed to concrete services.
Have you, given what's happening in the country, have you noticed any increased vaccine hesitancy?
No, I haven't. I'm still practicing. I'm seeing patients. If anything, I think people are concerned about vaccines not being available sooner than later. So are asking me more about what are they due for more than ever, because they're wanting to get what they can now because they're not really sure what's going to be available to them in the short term. So, but no, and during COVID, I would say that vaccine hesitancy for us wasn't really an issue because I know patients were not wanting COVID vaccines, but because we were a trusted partner within the community, that's I think that spoke volumes to why we were able to vaccinate so many patients. And when we were on the New York City scheduler, I forgot the name of it, when you could go on and get an appointment, we had a lot of people seeking us and looking for us because they recognized our name, and we were actually giving the vaccines. It wasn't like an agency within our four walls. So we've been doing pretty well with getting the message across how important vaccines are and how safe they are.
Erica Overton just raised her hand again, just if you would like to speak.
Hi, sorry, I lost you, but I just wanted to share the assembly member loves Ryan Health. We are always, she just recently met with them in Albany. We always make sure we earmark discretionary funding for them, and they were exceptional during COVID. They also helped us. We did an MPOX clinic. They would be welcome asylum seekers, the PS51. They were with us that day where we did a whole, clothes giveaway. They came to talk to the kids and to make sure the kids had their vaccinations. They are beyond excellent. And just a story of, we had a homeless person that would always come to our office. He didn't trust anybody but us. He didn't feel well. We had him go to Ryan Health. They diagnosed him with pancreatic cancer. They got him help at Mount Sinai, and they saved his life. And that man trusted nobody but Ryan Health afterward. And so they are just beyond. So I just wanted to share how much the Assembly member loves and appreciates them, and they are just a community, stalwart institution here.
Thank you, Erica.
Thank you.
No more questions after that. That was a good ending for us. Exit stage left.
Yeah.
Thank you so much.
Thank you.
We really thank you. And as I started, we really want to be seen as more of a presence. So feel free. I think I passed around my business card, and you have the pamphlets. Please feel free to reach out to us with questions or referrals. And
If we want to do follow-ups, we can invite you back.
Yeah,
absolutely, that's our intent.
absolutely. And now I know where you are, so I will not be late. I promise
One of
you.
the things that we would love to know is, are there certain health or lack of health trends? Like, are you seeing more diabetes? Are you seeing more, because of cuts in funding and whatnot? So over the next year or so, if you can
Sure.
let
Yeah.
us know about, there's certain areas with this greater asthma.
Oh.
Then, we know where those areas are, but we know them in our head, but we don't have facts.
That and data
And so
to follow
And the
up.
district needs the most data we can put in, the better it is.
Yeah, no, we can definitely have trends. We do stuff like that all the time where we're looking at the data and pulling it from our electric medical records to see what needs do our patients have as well.
And we look at the Department of Health and Mental Hygiene has community health profiles.
Right,
So
we
we
have
look at,
that.
we regularly look at that to make sure that our services are aligned with that center's services. So.
Thank you. Anything else? Thank you very much.
Thank you.
Thank you.
Hey, Will, how are you?
Next on the agenda is
Reach out to you.
Email, that's not, yeah, gotta see.
It's good for us to.
The famous person Fern.
Yes.
She became a member of that, public member, because she was the connection was strong. Build it up.
Thank you. Thank you so much.
Thank you for coming out.
Sorry. Amazing. Is there somebody here
The next
on the next agenda item?
They're already logged out.
Oh, boy.
Oh, it's online. Okay.
Yeah.
Michael,
Okay, so-
appreciate your time. Yeah, having this.
A couple of people say,
Same person.
health and mental hygiene,
This gets
but
taken
I don't
care
have
of.
their names written down.
Here on Zoom, we have Martha.
Martha.
Big for 30 years.
Yes, she's on Zoom.
And then he has water backing up. Should we keep going?
Okay, so we have, the next agenda item is on rats, and we have, the topic is rats. And we have, two people from the city.
Are they here yet? Yeah, there we go.
Hi.
Hi, good evening, everyone. Martha Vernazza from the New York City Health Department, Neighborhood Rat Reduction Initiative. I am the community coordinator. I lead our outreach and education team, and I want to share my screen. So let me bring that up. So thank you all for having us.
Mhm.
And let me know if I'm up. That should be it. Yes?
There you are.
Awesome. So again, Martha Vernaza from the Health Department, Neighborhood Rat Reduction Program. So with our Pest Control Services program, we promote a healthy and safe environment for New Yorkers. We enforce the New York City Health Code, Article 151.02. This indicates that property owners are responsible for keeping properties clean and free of pests. At the Health Department Pest Control Services, we do outreach and compliance. We do proactive inspections in areas that have been identified to have the highest burden of rat activity. I'll go through our inspection process thoroughly, but we inspect properties. When they fail, we send a commissioner's order to the property owner on record. We provide guidance towards compliance steps. We have specific staff for case management on these failed properties. We re-inspect to monitor owner compliance with the health code, with our compliance or follow-up inspections, and we then issue summons when compliance inspections are failed. So our Office of Pest Control Services in the New York City Health Department, we conduct pest management activities to prevent the transmission of rodent-borne diseases, prevent rodent bites, improve the quality of life for New York City residents by reducing rodent populations. Some of our key activities: we respond to complaints. We respond to rat complaints, nuisance complaints. We conduct proactive inspections of public property, city-owned and managed properties, as well as private properties. We publicize best practices for rodent management, so we have a lot of materials and resources. We educate neighborhoods and residents on rat management. You all may be familiar with the Rat Academy. The assembly member recently hosted a Rat Academy, so we've definitely been in the community board for Rat Academy. We promote pest management by pest control professionals. We do share our data through the New York City Rat Information Portal on our website, nyc.gov/rats. And when we work with City Hall's Director of Rodent Mitigation, the Rat Czar, and we collaborate with other agencies. So the work that we've been doing in Community Board 7 for calendar year 2024. So in Community Board 7, there are 4,422 tax lots. We were able to conduct 5,489 initial inspections. 19% of those failed. And then we did 1,134 compliance inspections in 2024, of which 64 failed. Those are, again, our follow-up inspections. So within Community Board 7, we have 2 of what we call rat reservoirs, but they're more like hot spots. So these are areas that we pay close attention to. These are areas where we have assigned case managers, assigned New York Health Department staff to help property owners towards those compliance steps. So in the Upper West Side Reservoir, which are within that rectangle in the blue, there are 576 tax lots. Of those, 24% failed in calendar year 24. We do have sorry, was there a question? Or that was just me? Okay, sorry, my sound went in and out. So in the Upper West Side Reservoir, we have collaboration with Riverside Park Conservancy. We work closely with the New York City Housing Authority, particularly in Douglas Houses, which is the largest housing development in the Community Board. And then, of course, New York City Public Schools, so that they pay specific attention to these city-owned and managed properties within this reservoir, within the community board. The
Can I just
Um,
ask? of
yes.
The upper and lower boundaries in terms of streets in that blue rectangle.
You know, I don't have those right now. I can get them to you specifically. But
That's 60,
Yeah.
I can go back.
yeah, it's 60,
Um,
96, that's just the upper west side.
It's
So
the
in our
whole
district, it goes up to
upper
110.
96, but there's another, later in the presentation, looks like she's gonna show the upper part of the district.
Okay, so this
Yeah.
is up.
It looks like about 96.
This is 96.
Uh-huh.
Okay,
Thank you.
And
So this is the Manhattan Valley area of our rat reservoir. So in the Manhattan Valley Rat Reservoir, there are 115 tax lots. 55% of those failed in calendar year 2024. And in the Manhattan Valley Rat Reservoir, it has the highest failure rate in the community board. So there is an assigned case manager for this area who works with property managers, superintendents, towards compliance steps. We are conducting those compliance inspections. We've been working particularly with the 109th Street Block Association and have been noting improvements in the containerization of garbage, which is important, and structural fixes around tree pits and around building foundations. So this is the Manhattan Valley area. In Community Board 7, our New York City Health Department inspectors conduct proactive inspections annually and follow-up inspections on properties that fail. Property owners are communicated with via mail, the U.S. Postal Service, and provided abatement orders and given time to comply. We do have those case managers and supervisors in the area. I will be sharing these slides with you all so that you have those names and those contacts. And then again, we work with our sister agencies, parks, sanitation, schools, NYCHA, to address those rat conditions on those large city-owned properties that are producing a lot of garbage. So just going over our inspection process. So initial inspections have happened again in Community Board 7 proactively, and also as a result of response to a complaint. So our inspectors will come out and visually inspect the exterior of the property to identify signs of rats or to identify conditions that rats favor. If there is neither, the property will pass the inspection. But if signs of rats or conditions that rats favor are present at the time of the inspection, the property will fail the inspection. So a property will fail if there are live rats on site, if rat droppings are observed at the property, burrows are observed, gnaw marks, so evidence of rat teeth by chewing or gnawing through items, tracks or runways, and again, those conditions that rats favor, so excessive clutter or mismanaged garbage. When a city-owned property fails an inspection, the corresponding agency will receive that referral report and will also be expected to make those remediation steps. When a private property fails that initial inspection, the property owner on record will receive a commissioner's order to abate. This commissioner's order will include an inspection report, so specific details about the findings of the inspection, specific details about where on the property, what on the property. The commissioner's order will provide time to remediate. The commissioner's order will have the health department's contact information. So the regional office's contact, as well as those case manager contact. And then the commissioner's order will provide notice that a follow-up or a compliance inspection will be conducted to ensure that the health code violations have been remedied. So when receiving a quota, it's important to contact the health department. Let us know, I got this letter. I don't know what it is. I don't agree with it. I don't see what you're seeing. It's not me, it's my neighbor. I need more time. Whatever it is, when you receive this letter, when a property owner receives this letter, we recommend that the first thing they do is contact the health department using that contact information on the commissioner's order. So then we'll come back. We'll come back for that follow-up compliance inspection. We'll see if the health code violations were corrected. If the property passes, there will be no summons issued. The ticket will be closed. If the property fails this follow-up compliance inspection, the property owner on record will then receive a summons subject to fines following the opportunity for a hearing at the Office of Administrative Trials and Hearings. So basically it's a summons. It's a summons saying you have to attend this hearing on this date at this time. It'll also have information about, in the event that you can't make that date, you can't make that time, changing that date and time. Fines are assessed by the Office of Administrative Trials and Hearings, and fines range from $300 to $2,000. So what should property owners do? Clean and sanitize areas where droppings are being seen, where garbage is being stored, sealing cracks and holes on stoop steps, sidewalks, perimeters of planted areas. This is some of the work that 109th Street Block Association is doing, and we are noticing change. So ensuring garbage containers have secure lids, are large enough to contain all waste being produced, making sure that all garbage cans always have a tight close. There shouldn't be any garbage flowing out of the bins, placed on top of the bins, making sure that garbage bins are in good condition, regularly inspecting for holes or disrepair, regularly inspecting for signs of rats. Again, learn how, attend our rat academy. Work with your pest control professionals. When hiring a pest control company, you want to ensure that the pest control company offers integrated pest management services. Make sure that they are licensed, that they are hiring licensed exterminators. And then also report those rat sightings to 311. Rat sightings on tree pits specifically, and rat sightings on city-owned or managed properties. So what can community groups do? They can schedule a walkthrough. We've done plenty walkthroughs with Gail. Hi, Gail. If you're still here, but we've done walkthroughs. We definitely do walkthroughs. You can schedule those through any of our pest control staff that works in the area. Here they are again. You can host a rat academy, for a rat prevention and management training. When hosting a rat academy, you do, as an incentive, receive rodent resistant garbage bins to be raffled off at the rat academy events. Hosting a cleanup event is what some of the community groups in the community board can do, to which we can also attend and participate, along with any community health fairs, block parties. We love coming out. We love meeting with the public and providing the information that we have available, also in multiple languages. So our Rat Academy, again, we have done Rat Academies in the community board. We are raffling off the New York City, the NYC bins that will be fully required starting June of next year. So here's our Rat information portal. Our website, visit our website. Our website is available in 30+ languages. There's tips for preventing rat infestations in your home and in your community. There's information about those rat mitigation zones where you'll be able to see those bordering blocks and avenues and streets. There's resources for businesses, also for pest management professionals, and then our rat information portal, which allows you to take a close look at our data, our inspections happening within the community board, our inspections happening at any property within the 5 boroughs. You put in the address on the search bar, the map will zoom you to that location. Green on the map is a past inspection. Hot pink on the map is a failed for rat activity. Purple on the map is failed for other activity, right? So those conditions that attract rats. Gray on the map is a property we haven't inspected in the past 6 months. So this is a place we ask that people visit to see if there is inspections happening in those properties of concern, in those areas of concern, before maybe making those 311 complaints. Just to see if we're already there. If a 311 complaint is made on a property that's already currently within that inspection process, a property that already has an open ticket, the 311 complaint will duplicate into that ticket. So a good place to start if you're thinking about making a 311 complaint about a property is this map on our website, nyc.gov/rats. You click on the you can submit the address to the search bar. The property will be identified by a dot. It will zoom into that location. You click on that property and you're able to see the last time that we were there, whether the property passed, failed, a date, a ticket number. So you'll know whether or not you have to make that call or you don't. Obviously, if you see the property that you are inquiring about that is gray on the map, definitely make that 311 complaint. When making those 311 complaints, you want to be as specific as possible. So you definitely want to provide an address to the property of concern, maybe the specific area on the property of concern where you are seeing the rats, the front, the back, the rear, the side, the alley. Also providing your information to the 311 operator or in the 311 complaint is important for us and for our inspectors in the event that they need access to an area that is inaccessible to the public. That be a gated alley or a rear yard that maybe can only be seen if provided access. So leaving as much information, as detailed information as possible, along with a contact is great for our inspections to be completed more smoothly, I guess. So we have these available again in multiple languages, orderable through 311. They are on our website, nyc.gov/rats. They can be requested to our email, ratportal@health.nyc.gov, along with our pictures, which are also available in English, Spanish, and Chinese. When you feed a pigeon, you're also feeding a rat. Exposed, overflowing garbage is like a five-star restaurant to the rats. And we're actually working on a poster that is to be encouraging for people to clean up after their dogs. dog waste feeds rats. So we're working on that. So more material coming. We're also on social media, where we have follow an inspector, tips for prevention, follow navigate our map. So we are on social media for different videos and tips. And that concludes us there.
Okay.
Thank you so much. I will be taking questions. Thank you again for having us.
Yeah, thank you, Martha. I had no idea that the war on rats was so organized. And also I didn't know anything about the.
We're working, we're
fines.
trying.
And the fines are, $2,000 is nothing to sneeze at. You had a question?
No, fines. Actually, I had a question
Yeah.
about, who's responsible for the subways and what are you doing about the subways?
Yeah. Did you hear that?
So subways are empty. Yes, the question was about the subways. So subways are MTA. With the subways, they've been doing different pilots with like the garbage cans. Sometimes you'll notice there's no cans on a subway platform. That's so they're not feeding the rats. Some with the subways, they also have sweepers that help in cleaning the tracks to avoid those rats from having that access to that food or that litter. So the MTA is responsible for the subways. We do receive referrals and provide referrals to the MTA. So that is also one of those agencies that we are providing the information to when the information comes or the complaint comes. So we are also inspecting those subways.
And in terms of private property, what if, suppose it's not an area that isn't publicly accessible, like a backyard, can a property owner deny access to a rat inspector?
A property owner can deny access to a rat inspector, to a New York City Health Department inspector. In the event that it becomes a problem about access and the complaint continues, we also work alongside HPD. Housing Preservation and Development. HPD cannot be denied access. So sometimes when we do need that help in the access to an area that we cannot or are not provided access to, we try to collaborate with our sister agencies so that we can do multi-inspections, and also, like I said, they do help us with gaining access when that becomes a problem.
Great. More questions? Yes.
I just want to say I was at a convention over the weekend and I saw your office very present there at the New York Restaurant Association, educating restaurant owners and managers on rat mitigation. So I was really happy to see your office is there. I do want to say my guess is if I went onto that portal, I would see a big hot pink, shading of. I just happened the night before last, I walked by 89th, 88th, 89th, and Amsterdam, which is 589 Amsterdam. They're under construction. That's a NYCHA project. And I personally lived in this neighborhood for many, many years. I've never seen a worse condition. I would call it an emergency personally. Everything that you described in terms of gnawing, unsafe conditions, open garbage, it was everywhere. And I heard people screaming in the streets that were just walking up the street, avoiding. Some people said they were used to it. It really seems to me to be pretty abhorrent. So I hope that 589 Amsterdam is on your list. And my last question, actually, well, that was more of a comment. The question is, your Rat Academy is great. And I wonder if your pest control companies, and especially if there's a certification, if they're required to attend, and if there are violators, chronic violators, property owners, businesses, whatever, that they can be actually required to attend. Like it's a chronic driver who has to attend a safe driving course, can they be required? So the question is, can pest control companies be required to get their certification or licensing? And can chronic violators be required to attend this in conjunction with their fines or to mitigate their fines or whatever?
Thank you for your questions. I'm going to share my screen and show you 589 Amsterdam. So it's right here. We were just there March 11th for an initial inspection, which means we will be coming back for that compliance inspection. I will flag it for our case manager in the area so that we can provide that follow-up if you like for that address.
Yeah,
So we
March
were just
23rd,
there, March 11th.
Yeah, no, I'm saying I was there on the 23rd and it was, yeah, that's all I'm
We're
saying.
there, we're working on it. It's pink, just like you said it would be.
Yeah.
And then, so for, oh no, I lost you all.
We're here, we hear you.
There you are. So for pest control professionals, right? So pest control professionals in New York State are required to be licensed by the New York State Department of Environmental Conservation. So they do attend, they have to go through I think it's 36-hour course, testing, licensing. So they do not attend a rat academy, but they are expected to have the knowledge to be licensed. It's important that people work with these licensed exterminators and know that they're licensed when working with them, because we want them to have the expertise and knowledge to be able to do the work effectively, right? As far as repeat offenders or people who are not regularly not in compliance with keeping their property free of those health code violations, they at this time are not required to attend Rat Academy. But that's where the violations come in. So they start at 200, then we do compliance, right? Because there's the people that are like, oh, I'll just pay it off, right? But when it starts becoming thousands, then we do our elevated compliance where we come back to check and come back again. And every time we are increasing those violations and getting them to those numbers where they are feeling impacted rather than just paying off the 200 here, the 200 there, in hopes that they will make efforts and will make those changes. And then again, we do also collaborate with other agencies, Department of Sanitation and HPD as well, who will also come in and do their violations as well. So they're getting, I guess, hit from different angles to make that impact, to hopefully make that change rather than just pay those fines.
Maybe the carrot and the stick, the carrot could be come to the Rat Academy and you have a $300 fine, but maybe it'll be a $100 fine if you do it, and it may be mutually beneficial to the community if they do get that education. Just throwing it out there, thanks.
Our incentive right now is that we provide or offer the New York City bins to those who want us to come out and teach. We have been collaborating more with management companies who are looking to have their staff attend. So it's a nice incentive and people are into it. Thank you.
Thank you.
Any
We
other-
have one question from the public from
Okay.
Erica.
Yes, Erica.
Hey, thank you, Martha. And yes, the bins were big. When we did our Rat Academy, we gave, I think, what was it, 10 bins to some different block associations that had requested it and they loved it. Question for you about Amsterdam houses. Oops, sorry, I just have my baby, we're doing bedtime. Amsterdam houses, is there anything that we could work with, the Assembly Member's Office could work with you there? I don't know if there, I know there was a lot of rat activity, there always is, but a lot, especially because they were doing construction, that's kind of teetered off in some ways, but just wanted to get your thoughts on any rat mitigation efforts there.
So I don't know off the top of my head, Erica, and hi, and nice to hear you. But I will flag it. I will bring the information back both to the community board and to the assembly member's office about what is happening at Amsterdam houses.
Okay.
And I will get that information to you all. So thank you.
Awesome. Thank you.
Any other questions? Anybody else online?
No.
Okay, well, thank you, Martha.
Thank you so much, everyone. I will leave the emails on the chat if it's helpful, but thank you all for having us.
Thank you.
Okay. So the third agenda item was added kind of at the last minute, about 4 or 5 days ago when I first found out about it. But the governor is very keen on including in the budget restrictions on mask wearing. And there would be exemptions for medical reasons for wearing a mask and religious exemptions. But it basically relies on the subjective impression of intent by somebody. It creates the crime of mass harassment. And so somebody could be accused of, if they're just wearing a mask, of trying to harass somebody by wearing the mask or engaging in some activity that would be prohibited under the law merely because they're wearing the mask. And so it's up to the police officer to make the determination whether the person had the intent of harassing somebody because they had a mask or wearing a mask. A lot of, well, the New York Civil Liberties Union has raised just serious concerns about, has very serious concerns about this, and has sent a letter opposing it with hundreds of signatories. But anyway, I wanted to, did everybody get a chance to take a look at the
Bills?
So you're familiar. So I thought maybe we'd have a discussion, and I know where I come down on, I'd like to have a resolution about it, but it's really up to the committee.
So it sounds on the surface to be really scary and invites discrimination.
Yes.
Any cop who doesn't like someone who's walking down the street and happens to be wearing a mask could make an arrest, right?
Right.
Is there any reason to believe that a law such as the ones that were proposed would eliminate crime or do anything
Well, it's
positive?
for crime, right? It's for harassment.
Pardon me?
That's for harassment. I mean, I think it's targeting people who go to protests and harass people when they're masked, right? This isn't like about COVID masks. This is about people wearing the kepis around their face. I mean,
But it could be any
it.
mask.
Right, could be any
And,
mask.
and it does talk about a new criminal act. So,
This is But it's a preventative action, right? Like this is a bill to solve a problem that doesn't exist yet. I'm not trying to.
I like
Right?
that.
Like,
That's
no,
very well done.
but like if there's exemptions for religious reasons and exemptions for health reasons.
Yeah.
I don't like.
And you know, I mean, you walk up to someone and they say, oh, religious reasons or health reasons. I mean, but I don't think the cop has to.
But that's also only the first step of justice, right? Like the first step in the justice system is having an interaction between law enforcement and someone who's accused of committing crime. And then we still have the entire judicial process. And I understand it's testy times and people are, we've seen behaviors from the federal government with leveraging finances to force Columbia to do things that are probably against what Columbia said they were going to be against until $400 million was pulled out from under them. But I don't know, it just feels a little knee jerk, like,
right.
Like, I don't know, it's parade in my So from my perspective at the moment, maybe there's different opinions here. I'm open to change here, but it just.
Well, in answer to your question, has there been any evidence that this has reduced crime? No, as far as I know, nobody's raised.
That it would reduce or it
That
hasn't been
it
implemented
doesn't,
yet?
that it doesn't reduce crime.
Yeah, but
Nassau
what's the
County,
crime?
what?
Like, what crime is it? It's not like.
Well, it's
mass
increasing the
robberies,
crime of mass harassment.
Right, that's it. I mean, it's, I don't think this is targeting masked people who are wearing a mask robbing a bank, right? They're targeting people who are wearing a mask at a protest is the.
Well, that's, I mean,
my
that,
interpretation.
they're not coming out and saying that,
Yeah,
but
right,
that's the reason for the law.
Yeah,
Is that they want to be able to identify protesters
Yeah,
and mostly pro-Palestinian
it would actually
demonstrations.
increase crime because there'd be more people arrested for it, real, I mean, ultimately, right?
Rachel?
Yeah, definitely. Like, I remember it was another state, wasn't this state, but the idea of like ski masks and other different facial coverings that aren't necessarily used at protests, but are used as like fashion statements. So I think it can kind of target people who are utilizing it as sort of like fashionable, whatever, and works in certain communities, but in the presence of another community, it's a problem. But also then you're running into the idea of like placing the problem on the person wearing it rather than the over surveillance that we're trying to give into.
But I think there is a real problem with masked individuals in this city, and we saw it, certainly during COVID, but like throughout a lot of different protests where people were using facial coverings as a way to evade justice. And like we have, I think as a society, we have these dual mandates. On the one hand, you don't want to harass people. You want people to be able to express themselves, whether it's religious reasons, health reasons, fashionable reasons. But then there's also people storming department stores or convenience stores or whatever it might be, wearing ski masks in the summer, and it's just a way to evade the surveillance that's around them. So like it's a complicated question.
It's not specific enough. Almost everybody who broke into a jewelry store or something across the nation were wearing masks.
And they're also committing a crime.
And
beyond the mask. So
Right.
The law's not going to stop there.
Right. It's a touchy thing. There are situations where it's inappropriate and situations where I think it would be appropriate. If someone's up to no good, walking in the neighborhood, disturbing people, and then we're walking into a store. Just think of a store. I was speaking to a person who has a picture framing store about this. If someone walks into her, not with a COVID mask, but with a mask, she will call the police immediately. Okay, because someone's,
I mean, what could the police do?
well,
I mean,
because
someone just
because
walked
she'd be
into her
afraid
store.
of being robbed. So she could call the police as a preventive method to get them there. But she said, because she's afraid. She's a single individual proprietor in her store, and people come in and been disturbing her, and she's even been robbed. In fact,
So if the same person walked into her store that was wearing a mask, and she'll call the police, but next time the same person walks in, it's still either scary or not scary, without a mask,
she felt
what's the
that
difference?
that a person, it goes back to the original mask wearing bank robbers. Okay, when someone walked into a bank with a mask on.
Yeah.
People felt that out to rob the bank. Okay, and this is just local. So there are a number of local stores that complained in the past that people came in. But then there's the issue of civil liberties and other situations. So it's not the rulings, are not specific enough. And I think that's the issue.
I think
So I'm, obviously, I care a lot about this issue because working in public safety capacity, I didn't realize this was on the agenda until just recently. I suppose the reason why it's at this committee is because mask wearing is obviously a mitigating factor for safety and health. So I have been quite busy and I skimmed through, but I'd like to read in more depth what the proposed legislation is. And all some of the things that were just brought up here, obviously, it's a very slippery slope, obviously. So the obvious questions are somebody is innocently wearing a mask to protect themselves. And that should not obviously be a crime, especially with what we just went through with COVID. On the other hand, I will point out that, and I'm sure the NYPD and the DA's office can talk about a lot of the mask wearing criminals on mopeds and in stores and the bash and grabs that's happening not only in our city and the challenge of prosecuting those people when they do not have a positive facial ID. So I haven't read, I'm not a lawyer, but it seems to me that it could be what I'd like to see personally is that if in the course of committing a crime, they purposely evade and cover their face, that be an increased charge.
That seems to be
That is what the bill.
No, absolutely.
It is not.
No.
Okay, because that would be my non-attorney, non-expert.
It doesn't increase the penalties. It says if you're wearing a mask, you're already suspect. And then they have to prove the intent.
I don't think that's
to having-
the purpose of the bill creates the crime of mass harassment as a violation, amends the crime of aggravated harassment in the second degree to account for mass harassment. So it's
Harassment.
It's adding to.
So this is not, so if I'm understanding again, that this is so quick and, I think it really deserves, especially on my part, to read more carefully, but if it's regarding harassment, right, we understand, obviously, this is another slippery slope as to, what defines harassment, right? Because there's free speech and then there's hate speech. So,
and that's part of where and they mentioned threats is part of this where it's coming from. You have 19th and 20th century examples of people, and they specifically call out something like the KKK, where these are individuals who are intentionally concealing their identity.
Sure.
It's a complicated issue, right? Like it has.
Sure. Well, I think we've all seen examples of perfectly innocent people wearing a mask because they don't want to get COVID, and also and exercising their free speech, whether we like it or not. On the other hand, we've also seen examples of people that are absolutely threatening with hate speech, and probably violating the law just by what they're saying in terms of, threatening, and also happen to be covered. So I don't know how to fix this, but it's definitely worth.
And I think it's important to call out here, like it says, add section 240.12 to the penal code to make a person guilty of the crime of mass harassment when they wear a mask, covering if they intentionally has to conceal their face as the primary purpose of menacing or threatening against another person. So it's adding a section. Like that's why I'm saying I think it's not
enhancing.
Yeah.
But it's not as if they said you commit a crime like with a gun, as opposed to a pea shooter, and so it's added penalties. It's
Oh, you're
not like
saying
that.
like in terms of like a minimum sentence.
Yeah.
Oh, that.
I mean, that's what I think Doug's like, that's maybe worth the governor and the legislature considering, but this is not that. But I just wanted we had a member of the public who weighed in on this and sent a letter and couldn't be here, and I'm not gonna read the whole letter. Although I could, but it's fairly long, but he's a doctor. His name is James Uhrig, and he is completely opposed to this proposal. He says masking saves lives. I'm paraphrasing. There's no evidence that crime goes down where mask restrictions are in place. It will result in targeting of people of color. And then he points out that under the current law, the offense of harassment is one of 3 misdemeanors that the police often use arbitrarily to arrest people who end up, as it turns out, not having committed a crime. And the other 2 are disorderly conduct and loitering. And we all know how loitering has been used, like in the South, for instance. So this would just add to that.
Let's not absolve ourselves.
Right.
And I think he makes a really good point. Also, I'd point out that in Nassau County, there are great concerns that this is going to result in the targeting of people like me who wear masks on the subway and in meetings like this when I'm not speaking, and stigmatizing people. And so what's happened in Nassau County is you get things like this. This was an Instagram message recently, quote, "So we should start taking pictures of people wearing masks and send them in to the police. These may be criminals who are armed and dangerous."
Maybe.
Maybe, but
The
this,
mask can't tell that they are.
right, but, I mean, if I'm in Nassau County and I walk into a Tasty Freeze or something, I'm gonna be wearing a mask. And I don't think
You look like a criminal.
I don't think people like me should have to prove.
You know, that
that
ice cream you're stealing, you shouldn't be doing
We're not armed and dangerous. So, and there is a group called Jews for Mask Rights.
Jews for masks?
Mask Rights,
Mask rights, okay.
Mask Rights.
There's always Jews for everything.
Who are actually leading this effort to.
Donna Liebman?
No, but she
New
did
York
write the
Civil
letter.
Liberties.
She did write an email. I got an email from her today about this.
And they've been,
I'm sure it's a big issue for her.
they've been,
She's a good friend, many years.
they've been documenting incidents in Nassau County. We have gathered 80 reports, including 65 cases of verbal harassment of people wearing masks, 19 incidents of physical assault of people wearing masks, 19 incidents of intimidation or stalking, and 15 situations that intentionally endangered the health of mask wearers. So to me, this is where this kind of thing leads.
So it seems like everybody is, that it's a little bit complicated and maybe they'd like to hear some more. So,
Well,
should we
the
invite-
problem is that the budget is supposed to, like our,
It's attached to the budget?
it's attached to the budget.
But these specific resos are state and assembly, these specific.
Kleiman Siegel is the one who just from our end.
Interesting, maybe we should have someone from.
But the problem is if it is in the budget,
It's still in the earliest, they're both in the earliest phases.
our full board meeting is next Tuesday, which is April 1st, right?
Second.
First.
Oh, sorry.
Yeah.
April 1st,
Just
which is the day that the budget's due.
Yeah, but.
Oh, yeah, right.
But this is not a budget item, this is an ongoing piece of
No,
legislation. which- It is
Hochul
attached.
wants it to be a budget item. So, and
Oh.
if Carl Heastie and,
Because she's trying to get it attached to what people want to be budgeted.
Right.
But there's a lot of opposition that I've read, but I mean, by
Yeah,
by
and-
people in the legislature.
right,
It's not, to me, it's not specific enough.
Hmm.
If someone's wearing a mask and we've had a few years of understanding what that is versus someone wearing a full mask with just maybe the eyes showing, walking into jewelry stores and stores like that. I understand how those proprietors would be very concerned and frightened, okay? Also, going back many years, I was walking up Broadway and there were three relatively young people circling me. And then they grabbed my phone. They were all wearing masks, okay? So, that was a specific situation, but had they not been wearing masks, I might have been able to identify someone.
But you still would have dropped, right?
Yeah. I think Rachel's point from earlier is actually, it's a very relevant one, which is that not every group has the same set of standards or values around. And whether it's a fashion thing, and how do you carve out a space to allow for expression and identification and not become the subject of harassment? It's a very.
But this is also about mass harassment. So I think if you walk into the jewelry store with a mask on, it's going to be very hard to prove that you're harassing somebody. But if you're at a protest and you're wearing a mask and you're, say, using hate speech, then it's easier to prove you're harassing somebody. So I think it's also, it's not, I think that, the text of the bill seems to be actually pretty specific about that. I find it hard to believe that, well, maybe it's gonna be, but that, I find it hard to believe that a policeman is gonna go find some random person walking on the street in a COVID mask and say you're harassing. Because you have to be harassing somebody.
You find that hard to believe?
Yeah. I was gonna say,
It's very stop and frisk.
Yeah.
Reminiscent of that time.
Yeah, police, I think, it'd be great to find, they have all the incidents, but I imagine those are incidents of people who are, who are anti-vaxxers or or like COVID libertarians who are harassing people for wearing a mask because, they probably were doing it for the last 5 years because they don't think they don't think COVID is real, as opposed to this bill, which is targeted, I think, at a very different population and a different problem also.
Well,
if you're gonna go up at a protest and say, Jews should not, what is it? What did the guy say? I want to kill all Zionists. I don't think Zionists should exist. Show your face. I think that if you're using hate speech like that, I don't see why you should not be protected.
But hate speech is not, that kind of hate speech is not against the law.
I know.
You can
So
say violent
right,
things.
but I agree. But show your face.
And people,
Why should-
and
why should
actually,
you wear a mask? Why
actually,
should you wear a mask
people
when you're doing
have
that?
a constitutional right to be anonymous in
Yeah.
public.
Right.
Not when you're. What do you? No, they don't. Where's that in the
Don't
Constitution?
they?
Not at all.
Well,
Find me the
in terms,
constitutional-
it's not,
That's
I'm
absolutely.
not saying it's in the
Freedom of speech.
Constitution.
You can.
It's the right to privacy.
It's the right to privacy.
So
It's not
the
a
right
right
to
to
privacy.
anonymity. Yeah. If you're gonna come up to me and tell me that I'm a Jew and I think I should die, you're telling me that you have the right to be anonymous when you say that? Come on.
Let's say,
Well, there's very
I
specific
think that's
laws.
generalizing.
Brand
It's not, it's not generalizing. It's very specific
Okay.
about this.
So Brad is a co-sponsor,
Yeah, exactly.
and that's strange to me.
Well,
Yeah.
but they
I'd
also
love to know why.
They reference, I think that the text of these things is important. They talk about the January 6th insurrections as another example where there was an effort to try to find people who were accused of committing crimes and the difficulties that come out of that when someone's wearing a mask. I think at the heart of it, my father was a police officer. I think that's important context. Listen,
He was a
police officer.
police officer.
And, he would say something to me, crime is always gonna happen, right? You can put every law in the books, you can put all these things. It's not gonna stop a criminal from wearing a mask. It's not gonna stop someone, they're not gonna wear the mask walking to the store and they'll pull it up to the last second before they walk in. If it's a protest, I think this to me seems to be, in reading it, there's an effort to revert to the way that a lot of laws were written previously, that were done away with during COVID because we were all requested and required to wear masks in a lot of situations. The result after that period is that people were then also wearing them in contexts where it made it hard to identify people committing criminal acts. And so this is a way to maybe try to mitigate that. But my point was that people are going to commit crimes regardless. And the question is, does this open up the avenue for harassment in the same style of a stop and frisk? And what rights may we be entitled to, constitutionally or otherwise, to privacy or anonymity? While I think that, there's the chance for this to be like an abused thing. I don't know, I'm generally in the position of less is more. And so I'd probably not try to move forward with this, but I see both sides of it. I feel like I've spoken in support of both sides of this conversation. So,
Yeah.
I think I'm happy to continue the conversation. But
You've been hopeful with both sides.
It's I agree with you. It's symbolic, it's not gonna have any major impact on anything. So it's very symbolic to show that they're trying,
Well, I think it could have impact in the sense that, if it becomes a vehicle for harassment in the other direction, then it can start having impact.
Well, what I just read from Nassau County, it's clearly.
Yeah, but I bet if you looked at that before the mask law went into effect, I bet you the numbers were not that much different too. Because there's a certain population who are going to harass people wearing masks.
Well, you have to admit this kind of invites it a little more.
I can see that, but that would only be, but no, I don't think so actually, because that would be harassment by officials, like the police would harass you, as opposed to, people who are, the kind of harassment they're talking about is just public harassment. I think
Right.
those are people who, will harass people for wearing masks.
But now they have the force of law on their side,
Yeah,
saying,
it'd be-
no,
anyway,
you could be a criminal.
it's possible. I think the numbers are probably the same.
I really am curious, as you said, why Brad Hoban's and Siegel is behind this, because
Sponsor.
I would like to hear from him, because I generally trust him as our elected official. I'd like to know what his rationale is. But, and I do wish this was inverted, where, I'm repeating myself, that it was an aggregating charge if somebody was actually harassing someone, not protected speech, but actually, violating the law and wearing a mask to conceal their identity, that it be an aggregated and additional charge, not the reverse, which apparently is the way this bill is, but I haven't really read it through enough to make that.
The concern I think that you're bringing up as far as trying to do something tonight about this is that because the timing of it, we effectively have no time.
No, you're right, we have to do something.
Like if we want to bring something to the
Yes,
full board.
yeah, we have to do something.
This is the moment.
We don't have to do something tonight.
We don't have to.
We didn't do anything one way or the other on the discovery laws, because we're going to come back and have some more more people speaking, which is also in the governor's budget, whether we make it, I mean, the governor's budget, as we all know, gets delayed.
Mhm.
So, I mean,
But whether
to me, I
it's
think
gonna
we don't
get
have enough
delayed a
information
month,
to make that. Just like the discovery laws, we didn't have enough information to pass a resolution or fail a resolution, and that's why we're going to have speakers come back at our next steering committee to talk from the defense side. I think you have a similar situation here.
Well, it's helpful, I think, that it is one of our elected officials specifically as a co-sponsor of this bill that makes it
invite
specifically sort of relevant to continuing
I
conversation.
think if we did have a
Well, Michael,
resolution,
sorry.
and if we did have a resolution tonight and it passed, we would go to the full board and we'd spend 2 hours having a discussion about it, because it's one of those touchy things with people, depending on what their experiences are and what's going on.
Does anyone here feel confident enough with the information that we have without having heard from a co-sponsor of the bill?
Yeah,
that we
especially
that
our
we
own
could speak,
elected
even if we
official.
came to a majority of an opinion,
Yeah,
that we could then properly explain that to
yeah,
40.
I think it would make a difference.
I think we should hear from someone who's espousing passing this,
I agree.
All
as
right,
well
so-
as somebody who's against it, who has like the civil liberties here. But I think that we should have a reasoned discussion. I mean, this is, it's like, as Doug said, it's like the discovery reform. It is tricky. So I know that the budget is now, but I think I would, and I think I'm against the bill, but I think that we should hear from both sides.
Okay, so let's wait, see where we are at the end of April, and maybe tentatively put it on the agenda for our April meeting, and have Brad come, or one of his representatives,
And someone from civil liberties.
and somebody from the Jews for Masks, right?
No, I think
There's
someone
Jews
from
against
the
masks.
law.
I was on the mask task force, giving out masks in the subways,
Oh.
from community emergency response teams.
Has there been any indication that during COVID, when everybody's wearing masks, that there was a rise in crimes that people concealed themselves? With men concealed themselves?
There's certainly a rise in crime, but I don't know about.
No, I know, but is there?
I don't think it was COVID masks.
What?
I don't think people really think COVID masks.
But everybody was wearing them, so
Yeah.
bad
Right.
guys could wear it as well as
But that's the thing,
COVID.
it doesn't, it says there's exemptions for medical reasons, religious reasons, but.
Well, to answer your question, this is
You know, it's scary,
non-scientific.
But a scary mask that's used by criminals.
My non-scientific, non-data backed comment is that probably during COVID, not as much, because a lot of people were home anyway and afraid. But I do believe, this is just one person, that since masks became ubiquitous, people that were in the habit of committing crime went, hey, that's a great idea. And conceal themselves and,
And we saw it even
and-
with like that assassination of that CEO from Walgreens, whatever it was, where the accused.
Healthcare CEO.
Yeah.
oh, you mean United?
Yeah,
Was he
where
wearing
that
that?
person, he was
Oh,
wearing
yeah,
a
right,
mask.
but he didn't wear it very well. 'cause-
No, he wore it for a very long time, and it was only the image, the hostile.
Right.
Which was in our neighborhood.
Yeah, which-
But if that's your concern, I think your idea is the way to go.
Yeah.
You know,
Make it
it enhances the
aggregated.
crime.
Yeah.
Aggregated, that's much better.
Yeah.
But
yeah.
Love to talk to Brad, hey, Brad's the lawmaker,
But his bills, his legislation are always very well thought out and very clear. I don't know to what extent this is his.
he's a co-sponsor.
I know,
He's
but
not
that
the
doesn't
ultimate-
mean it.
No, I know, I'm just saying like. that's
Doesn't mean
the
it's his bill.
Yeah.
I
His
talked
sister-
to Linda Rosenfield about it informally, and she was pretty on the fence.
Okay, so there's an assembly, there's a sister.
Yeah.
Yeah, there's a
Yeah.
In the
Senate and
assembly as
Assembly.
well.
Yeah.
Interesting.
Yeah.
All right, so somebody are you gonna get in touch with,
Yeah.
with both sides?
Both sides? Do you know anybody from New York Civil Liberties?
I know. I forget.
Do you ever?
Why don't you try to get, you
Of
get
course you
Don,
know.
you get Donna Lieberman. and we'll-
No, the person I know has not worked there in 26 years. That's okay. But I do know people who work there now.
Okay.
They're good people.
They're good.
Okay.
Okay, and who's gonna get someone from the other side?
From,
I don't know.
well, we'll have Brad, and
Okay.
he'll be the other side, because
Yeah.
he likes the
He'd
bill.
probably like to come because he's running for office. And
Yes, yes.
he's running for something.
He's
He is
running
running for
for
borough president. Yeah,
against Keith Powers.
that's right.
And you know what's interesting to me, and I can't resolve it here. I know people who live in the outer boroughs, in poor neighborhoods,
Poor guys. Poor people.
and they, a mask is gonna be a robber or a killer, okay? They're living in a different world, okay?
Well, or at least they have different fears.
That,
and
that,
some
I
of
think
them
that's
were-
the important, it's the perception.
Your perception, right?
And
And-
that can lead to biases and.
That's why this is so dangerous.
Yeah.
It's about perception.
It's a
When
Is it?
I
I
walk
think it's
into
a-
stores upstate with a mask, I'm scared,
Mm-hmm.
frankly, yes.
And, but it's,
Actually, walking
it extends
into
beyond that,
stores
it's
upstate
how
is-
you dress, it's how you.
It's the whole,
Right?
it's the whole.
You know, people have to deal with these things every day, so, you know, are we adding to that burden? If we're supporting, but I think it's a great, I think that we're all part of the, it seems like we're all in rough agreement that maybe we need more.
Yeah.
So,
But then if it becomes part of the budget and passes,
Well, then
then it's off the
That's
agenda.
moot anyway, yeah.
And nobody wear a
Wait,
mask.
to speed things, I mean, obviously, with regard to the discovery, we're gonna talk again at steering, right? And then the following full board. I guess it doesn't make a difference because we're still, if you're gonna bring it, no, actually, it would be, if you're bringing it back to this committee,
Mhm.
and then we're talking about the following full board,
Right.
We can still do it.
I guess you still, but it might, I wonder if it's something you should be brought up at steering
And it could
to
still
speed
be.
it up a bit, or does that?
It wouldn't really, it would be the
Because
same
usually
full
we go to the
board.
next full board, right?
Yeah.
I was just trying to see if we could.
I mean, if Beverly wanted to have Brad at steering, that would be okay. It would take a lot of time.
How things go
Yeah.
in terms of resolutions. So say if we pass something tonight, you know, just theoretically, and it went to full board and somehow it passed, you know, okay. It's always what happens to it next, okay? And my thing has been, when I was chair of the board, was if there was a resolution that was strongly supported by the board sent it to the other borough boards, Manhattan, and if necessary, or widespread to the other boroughs, okay? And brought it up at borough board, got borough board to support it. And, you know, and from there, that gives it weight, and then taking it to the borough president, to the legislators and so on.
Mhm.
If we pass a strong resolution opposed to it, for instance, and we walk out feeling really good, nothing happens.
Right.
But I think in this instance, if
We've
you,
spoken.
if you have.
No, it's important that we have the discussion.
Yeah.
But in terms of having an impact on our advocacy for or against something, we have to expand.
Of course, but But I think here you actually have a unique circumstance or a rarer circumstance where a co-sponsor of this bill who is running for office, we are the representatives of the constituents that he also represents. And so if we came out in support or more importantly in opposition to this, I wonder how much that informs his decision to maybe pull back a little bit or to not push this as hard.
Or to amend it.
Or to amend it.
Right.
We are his constituents. He reports to us, and since he's co-sponsoring the bill, I think we'd like to know what, hey, what.
I think that's the other.
What are you thinking? And here's what we think, and
Out of respect also.
Yeah, I think we probably all wish that we had an opportunity to have more information. If people want to vote tonight, if they're feeling strongly one way or another.
I'm not on the committee, so you guys can do whatever you want.
Well, I don't know, I'm getting the sense, I mean, I would like to vote tonight.
We could still vote, and then depending the outcome of that vote, it might inform, there's 4 options, right? It's
Well, maybe we do a straw poll, how many people think we should come to a decision about this tonight?
Is this committee only? Think am I the only non-committee member here?
Yeah.
Okay, then I'll.
So as far as, you said,
should come to a decision tonight and take it to full board if it passes.
So all in favor of the decision tonight?
Yeah.
Raise their hands.
So it's basically a tie. Yeah.
That wasn't a vote, that was a straw poll.
Yeah, it's just a straw poll. Yeah, so it would, a tie is a fail, so.
Yeah, I feel like in the lack of hearing, as much as I wish we could, I just feel like there's great opportunity to be better informed. And while I feel like I probably.
Let's hope the budget is delayed or it doesn't make it into the budget.
And if I might say, the opportunity, besides weighing in for a vote, the opportunity to have more discussion about it, I think can elevate the conversation, good, bad, or ugly. And no matter what Community Board 7 votes on, we'll all be smarter for it in hearing everybody's opinion.
I also think even if something does, like if it enters the budget, if there's statements made even after the fact are still important. Like
we could pass a resolution decrying.
Yeah.
We could.
I don't think it's gonna get passed.
Maybe not.
I think it is. I think if the governor wants it. And the governor, no, I'll tell you why. Because the governor has the executive budget and the ultimate say. So if this is important to her, she's going to get a lot of support by the people who want her to support their items, member items.
There's a lot of horse and pony training.
And the governor has tremendous power in the budget process.
Okay, so
There's new
business.
Yeah, can I?
Yeah.
So there are a couple of things. Ken and I thought we would ask everybody here what topics they would like us to bring a guest speaker or to bring to the group for discussion, because it shouldn't be like our imposing what we think is a good idea. So. What?
I think, for me, I see often in my neighborhood, it seems like food insecurity is definitely like a big issue. I see folks that are lined up weekly for food distributions. And I know just in conversation with other folks in the neighborhood, like the access to the resources to help continue to support members of our community who need support through their food insecurity. Those resources are diminishing. So either, finding ways to provide additional funding or.
I'm in agreement I'm in agreement with that, but also if people are unaware of what's available, there are at least 17 programs to provide breakfast or lunch or some meal, and they're underutilized. And even if we could have a card made up once we had that information. That could be distributed or I remember we
You like the immigration cards, the red cards?
What's that?
Like those red cards.
No, we had those flyers that we put out. That's I can't remember where it came from, but it was about the food distribution that was coming from like the fresh produce, like
fresh, but this is 17.
No, I know, but I'm saying like something like that where it's just like things that are, because I agree, like there's just more information around the neighborhood,
Right.
whether it's in flyers or on the link kiosks.
And also, to people who have to, priests, ministers, rabbis, imams, that they should be able to hand that card when someone comes to them for food and saying, here are places you go.
I think the survey of social services like that beyond food, like in our area, kind of like what Ryan has, I guess, their list of, agencies that they refer people to. But having that, not only for food, but for housing, for.
Make it more of like a network, like a support network, where, get rid of these silos and have,
Some of the-
we've run out of food today, but hey, maybe these other folks.
Yeah, but also if you need food, if you need housing, if you need, whatever, educational assistance, transportation, because and I know there are some agencies that do everything, but, just having because I think people who have food insecurity probably have other issues like, help with, housing or whatever, facing eviction, those kind of things would be, to me, that's something that this, we could really do.
Another thing with mental health, there was a lot of talk about all the resources to teenagers in particular in schools. But I found out there are only either 16 or 18 mental health clinics in city schools from all the high schools and middle schools. That's reached number 16 or 18. So what kind of coverage is that? When we're talking about hundreds of schools. And people saying, oh, well, don't worry, it'll be taken care of at school. And it's such a vulnerable population.
So, but the question is, what can we, as a committee, do? Like, who could we invite to educate the public, or?
Well, we want to know what's available, first to find resources for teenagers. Okay, I know, for instance, with Douglas houses it was 2 summers ago, I got a call that they removed the teen program, camp program, so they didn't have one. What's going on there? What's available in our community for teens in the summer, and resources for mental health. It's a real serious thing.
But I don't want to get into politics, but it's going to be more serious because there's so much cutting of things that look like they're, helping poor people or helping people in need.
Right.
And I suspect by the time we get to the summer, it's going to be much
But
worse.
even what we have, even what we have, how real is it?
Sorry, no, go ahead.
Go ahead. That's
Yeah, no, similar to what we've mentioned, especially with like college students, especially like with different protests and everything coming up, they feel isolated from their universities, and often they're left to feel like they should rely on their universities for healthcare, food insecurity, all of these different things, and be able to like fully be enveloped by those resources. Yet like a lot of college students I know don't know about different programs for free meals, for assistance with signing up for Medicaid, for example. Like although it like a lot of students are below the poverty line, can't get into a job that provides healthcare for them, and they do need to like apply for like alternative insurance routes. So I feel like more integration of college students with the environment. I know it's hard with like Columbia and NYU because they take up a lot of space within the actual borough, and there's a lot of like disputes on like how much housing they're taking up from other people. But I also think like you're priming these people to go out and work for the borough, and you don't want to just, I mean, a lot of them may leave, but like you're also going to have more people who are going to stay, so you want to like cultivate their health and belonging as a
They're members of the community.
Right.
Just because someone's here temporarily in the phase of their life doesn't mean they're still not members. We're all passing through.
Yeah.
But it's
Especially in New York.
But again, there are lots of needs in our community, in our world. The question is, what can the Health and Human Services Committee of Community Board 7, how can we contribute?
You could compile the resources or like do a
Compile?
how-to guide, for.
So who's going to do that?
Do we have money from, isn't there fund, the city has a lot of money, so we could probably talk to our representatives, get some discretionary funding to fund somebody to do that. I would think, there are probably sources we can look for.
there may be, all the stuff may be available. Okay, we don't know where it is.
Right. Yes, and there, there's a senior task force that Roberta has on, and they meet monthly on Zoom. And for senior citizens, there are offices, various elected officials that have very, very exhaustive lists of available services. Now, I don't think it goes beyond services. I know Shelley has had wonderful experiences with those lists, but I'm sure some of it's okay, but some of it's not. But I don't think it goes beyond services available for seniors. And if we're talking about now college students and a broader segment of society, I just think that probably if we got some of those lists, we can see the categories and the.
I think it's like, if we're hearing food insecurity, we're hearing about housing insecurity, healthcare for young folks as well. Like in the same way that we've had hospital systems or healthcare systems come in and say, and Shelley brought this point up earlier, we have a targeted request for $250,000 in the budget for a specific machine and it addresses a need. That gives us an actionable item to then go to our elected officials, in whatever capacity, and say, this is what we are hearing as a need from a resource in the community. This is the problem that we're experiencing as members of this community. And we support the actionable, the action of providing this funding to resolve that. So for example, something like the food security, it's going to an organization that is trying to resolve that issue and asking them, let us know like what you are spending, what you are seeing, and how much money or what actions we can take to help you further your mission. And then we can hopefully come to an agreement in support of that, hopefully. And then take that to our elected officials and say, this is what we are hearing from a resource and we as the people support it. And then that's all we can do at the end of the day. That's the extent of our.
Or we can have an expert.
Of course.
And say, here are the resources, here's like the complete list.
Get like West Side Campaign Against Hunger to come and give a presentation, because I'm sure they're plugged into all those other resources, would know like the extent.
Who was that again?
West Side Campaign Against Hunger.
Yeah, but they presented to us.
And we've had them, and we always support what they are, but the key is if we identify a segment of the population that's not being served or needs to be outreached to, we can bring that to them, and we
like for part of this, it's coming from like recent conversations that I've had with a priest at the church that I attend, where he's talked about, they distribute food to a growing list of people every week, and they're getting to the point where they're sort of they're unable to continue to meet the demands, and like they try to give everyone a little bit, but it's to use the bill, especially you're from Peter to pay Paul, like you only have so much.
And Peter and Paul would approve of it.
So my point is,
and Mary,
so someone like that, and I've talked to him about potentially coming here to speak and give his perspective on things as well. But I think that's an opportunity where it is connecting them with other organizations that maybe they don't. And of course, all groups have different restrictions, right? They may have to only rely on Catholic charities or something like that. But the point.
As a non-committee member, but I obviously care a lot. I'm trying to think this from 30,000 feet up. So some of the topics some of the subject matter was brought up does cross over into some of our other committees, right? So for example, obviously this is Health and Human Services, and I don't want to be too literal, but then we have Youth Education Library. So youth probably ties in, maybe it's a joint meeting with someone from YEL, especially if we're talking about the youth in the community. And then and then of course, housing insecurity. That's obviously our housing and land use. And I'm really scared on so many levels because I think this federal administration is going to be attacking every part of entitlements, SCREE, DRE, SNAP, HPD, Section 8. I am so scared. And I think we really need to be in a very defensive posture with every committee and everything we can do. So I think it's self-evident, but some of the things that I just thought of, because you asked, were on the health part of the HHS is just health. I just think about health at home, right? Just even in your living conditions, mold, water, lead, asbestos.
That's housing, isn't it?
Well, it's health too. They're health issues, right? Yes, it certainly can tie into housing if it's something that, with the
Well,
landlord.
maybe you're right. Maybe there are things that you need to have two committees working together, but
In some cases, I don't want to like overburden us, but then nutrition, right? And noise, sound, stop the chop, all right? These are, I mean, that's P and E, but it's also health. Yeah. Bye.
It's been like a
Take care.
subject that we-
See you later.
And like that's part of the health of the neighborhood as well. So like, I think that there are ways to integrate this. But
Sure. I really think we need to be in a triage mode right now, because I think we're really, I mean, I don't know if anyone was at State of the Borough on Sunday where Mark Levine, Jerry Nadler came out, and he was absolutely sobering, just not pulling any punches, and just said, this is the fight of our life right now. And I think it's gonna hit every committee and everything that we're doing. And I don't know what we can do to be an equal and opposite force, but I think we should all think about it deeply.
I think, right. So listen, Rachel just left and I think we're leaving.
Yeah.
But before you do, I have one more thing. And we can talk about it next time. But I've been thinking that we have a lot of interesting topics that we bring up here, and then we leave them and we never follow up, and and they're here and they're gone. So like, for example, the immigration discussion, I thought was very worthy, but I think that there's so many things going on with the immigration and undocumented people that I would like to suggest that we save a small part of every meeting for follow-ups on interesting topics we've had, and maybe call someone back for, an update, but to pursue something so that it's not a one and done thing.
Right.
It's also.
I don't know how you feel that, we could talk about it next time, but.
The scope
New
of
business
it,
and old business.
the scope needs to be manageable too, like. it's not-
Of course.
it shouldn't be Immigration, it's gotta be like.
No, it's gotta be-
Immigration, helping the church, I forget where he's from, but helping, you know what I mean, like something very specific.
Absolutely,
Yeah.
absolutely.
Great.
But that's what,
Great idea.
but the concept of
Yeah.
following things through a little bit, I think, for me.
Makes sense. By the way, one thing that we're doing possibly in conjunction with BCI and our state assembly is getting cards. I requested that they're printed in Mandarin and Spanish and multiple languages that we're going to be discreetly passing, discreetly passing out to restaurant staff. And
Like those
other
red
instances.
cards?
Well, I don't know which color they are, but they're a lot of different elected officials, but State Assembly Member Rosenthal, they had some cards, and I suggested that they also, because it was requested, that they be in Mandarin and some
They
other
are.
languages.
The ones that Kate Carpet,
They're in Mandarin too?
they were in
French, Spanish,
French,
English.
Creole, Mandarin, they have.
19 languages.
Oh, terrific. Well, I know that Assemblymember Rosenthal's office is also printing some, but as it relates to BCI and restaurants, discreetly getting them to the restaurants, so that, we want to be discretion,
So
obviously.
this was interesting.
We had a meeting, Westside Federation,
Motion to adjourn.
housing
Oh.
meeting, and one of the big issues was getting all the social workers and building managers together so that they would know exactly what they need to do if someone enters, and
And
so
it's getting really dicey because now the federal government is saying that they don't really, that they can take you and send you to,
Louisiana.
well, they can send you from Louisiana
El
to.
Salvador.
Venezuela.
Or Guantanamo.
Yeah, El Salvador, without finding out if you're really a member of
Right.
a bad group, or without finding out whether you're some people may not even be undocumented people that they're sending away. So, I mean, it's really scary, and the positions they're taking in court are unbelievable, but I think it's gonna get worse, so.
Yeah.
I think those cards are at least something.
sure enough, they were useful.
Yeah, I handed all of them out. I want to get more from Kay. I mean, a lot of people really wanted them, so.
Anyway, motion to adjourn.
Shall we make a motion to adjourn?
Hold on. Anybody opposed?
But it was good.
I didn't know if the conversation